in journalism.
You're listening to the Mid-Morning Talk on Salam Media, and on today's awareness, we are focusing on Alzheimer's disease and dementia and how it affects the elderly. World Alzheimer's Day, which is observed on the 21st of September, is an international campaign aimed at raising awareness and challenging the common stigma that surrounds the disease. And to tell us more is Dr. Ryan Fuller. Good day, Doctor, and thank you for joining me. Hello, doctor.
Can you hear me?
All right, I can't
Hello?
seem to... All right, there we go. Hi, Dr. Ryan. Thank you for joining me.
Hi, Miriam. Can you hear me?
Yes, I can hear
Hello?
you.
Brilliant. So thanks for having me. How are you doing?
I'm great. Thanks. And yourself, doctor?
Fine, thank you. Good, thanks.
All right. So, doctor, Alzheimer's disease, how common is it? I mean, since we've just passed the awareness day and we don't really know much about Alzheimer's disease. What is it and how common is it?
Thank you. So the first thing is Alzheimer's is the commonest type of dementia. So a very common question is, what is the difference between Alzheimer's and dementia? In effect, it's the same thing. Or Alzheimer's is a type of dementia. Dementia means brain failure. It's a syndrome, meaning there's lots of different causes of it. It happens over a long time. Unfortunately, slowly progressively, the brain starts to decline. It's not normal aging. A lot of people think that as a person gets older, that loss of memory is inevitable. That's not necessarily the case. It's relatively common in the sense that it's about 5% of people over the age of 65 will have a dementia syndrome, not necessarily Alzheimer's. But the concerning thing is that prevalence doubles every 5 years. So at the age of 70, it's 10%, 75, it's 20% of people, etc. And so as people get older, more and more people, unfortunately, will suffer from Alzheimer's disease. The way of thinking about it is it's an abnormal protein in between the brain cells called amyloid, which in itself isn't a problem, but if there's too much of the amyloid and other abnormal proteins inside the nerve cell, that can cause the nerves to stop functioning in the brain. Alzheimer is the neurologist that first described it over 100 years ago, if that makes sense.
Mm-hmm. Right now, what are the symptoms associated with Alzheimer's?
So the commonest symptoms initially, if it's Alzheimer's, is a loss of short-term memory, which leads to people that suffer being increasingly repetitive, sort of telling the same stories again or asking the same questions again. And then perhaps difficulty with word-finding problems, not remembering names of family, it's quite common. Getting a bit lost more than usual, driving on familiar routes, and then difficulty managing finances. Whereas someone was very organized submitting a tax return, now they forget to submit a tax return. And so it's impairment in level of functioning, decline from what we call a baseline level. That would be the commonest. It's not just memory is the main point. Yeah.
Mm-hmm. And can anyone get Alzheimer's? Anyone at any age? Is it more common in men than women, etc.?
So there's no ethnic predilection. So the short answer is that anyone can get Alzheimer's, but typically it's over the age of 65. We call that late onset Alzheimer's disease. But you do get younger onset under the age of 65. But that is relatively uncommon. There are other types of dementias. One is called frontotemporal dementia. That can be under the age of 50, for example. But that is less common. And more or less, it affects men and women equivalently. Of course, women generally live longer than men. Their life expectancy is greater. And so you tend to see more women presenting. But from a risk-adjusted basis, as far as I'm aware, it's a similar risk profile to men or women. Yeah.
Mm-hmm. Right now, how is it diagnosed?
So the diagnosis, it's a clinical syndrome, which means that it needs a clinical diagnosis by an expert. A GP will pick it up, typically a general practitioner, or perhaps a community nurse or a family member. But a standardized memory test is necessary by someone trained in that. So a GP can, that's called a mini mental state examination. There are other types of bedside cognitive tests that can be done, but the memory is tested in short. And as long as there's no active other medical problems, one tends to start thinking about that. So it's in the assessment, basic blood tests have to be done to exclude any major medical problems. And then typically a brain scan is done at some point, a CT scan or an MRI brain scan, to check if there are any sort of telltale signs. And there one would be looking for atrophy or loss of volume, what's called the medial temporal lobes on the side of the brain. It's important to say that the brain scan can be normal, blood test can be normal, physical exam can be normal, and yet the person can still have quite profound memory problems. And we're also important to say that the commonest things we see aside from Alzheimer's that cause memory difficulties are stress disorders. So when someone retires, certainly with lockdown, if there's a lot of stress in the system, in the family, at home, and depression, what we call pseudo-dementia. So there's lots of different causes of memory decline. It's not all Alzheimer's. That's sort of take-home message.
Mm-hmm. All right. Now, what treatments are available for Alzheimer's, and can it be cured?
Unfortunately, the answer is it can't be cured once the diagnosis is made. We make a provisional, what's called a possible or probable diagnosis. So we say that it's more than likely this person, unfortunately, has this, it is irreversible, this progressive decline. A lot of medical conditions, chronic over a long time, are not cured. If you take hypertension and diabetes, those are not cured. They're managed with treatment. In a similar way, Alzheimer's and dementia can be managed. The treatments available don't change the underlying pathology or reverse the pathology, but they can slow it down. And so these are typically what we call cognitive enhancers or memory tablets. For example, donepezil, Donacept, and there are others that can, if they're taken every day, the person engages in activities and sort of non-pharmacological measures, you can slow down an inevitable decline. And of course, we try and treat insomnia or not sleep, stress, depression, and all of the associated impacts of this illness, as well as with families. A lot of the work is what we call post-diagnostic counseling, trying families, helping them to adjust to what is a difficult illness to manage. Yeah.
All right, Doctor, going forward, what advice can you give us, especially, with, like you just mentioned, helping families with who are living with someone who has Alzheimer's?
Yeah, so I think I'd start by saying if the person doesn't have a confirmed diagnosis, but the family are worried about their loved one, step one is making sure they see their GP, and that their GP has an opportunity to get to know them well with a good medical record. And even if with COVID, it might be through virtual telehealth, teleconsult, as long as the GP is the first port of call, basically. And they should talk to the GP and explain what they're concerned by. This is the family. And the GP will then know whether to make a referral to a neurologist, geriatrician, or a psychiatrist or psychiatrist. If they already have Alzheimer's and they're at home, I think it's important to make sure they're not taking the wrong medication, because a lot of the time patients are given medication to help their sleep, and because they're agitated, and that can become toxic in the brain and cause falls and bigger problems. So it's important to make sure that the treating team is aware of whatever's prescribed. And then the other thing is to know that there are other what we call allied healthcare providers, occupational therapists, social worker, and clinical psychologists, perhaps a physiotherapist, biometricist. There's a lot of team of professionals that can assist with the difficulties of managing a patient. A lot of our work is helping the family employ a domestic worker or caregiver that gets trained in how to help the person so that the family can have respite, perhaps go to work and have a break and not have what we call caregiver burden or caregiver burnout. So there's a lot that can be done, and one need not be hopeless and feel like there's nothing that can be done. But it's not the case.
Mm-hmm. All right, sir. Thank you so much for your time, doctor, and have a wonderful day.
You too. Thanks for calling. Take care. God bless you. Goodbye.
Right, so that was Dr. Ryan Fuller taking us through Alzheimer's disease and dementia and how it affects the elderly. If you know or if you think of someone who might have Alzheimer's or even dementia, the first port of call is to see your GP or their GP rather, and the GP will take it from there and will be able to point you in the right direction. And whether you have Alzheimer's or dementia, the GP will be able to tell you who to see next. And also, if it does happen that they have Alzheimer's, there is help available, and you don't have to do it alone. Like there are caregivers, there are therapists, there are all of those other people, those other professionals that are available to help you and your family out. So you don't have to do it alone. And may also, if you are helping to look after them, make sure that they are not taking the incorrect medication, that they must take medication that is correct for them and for their condition, whether it's dementia or Alzheimer's disease. All right, guys, that brings us to the end of today's broadcast. And I will be back after 2 weeks, inshallah, so don't miss me too much. All right, tomorrow it will be a Nafisa Dango, and you can catch me at the Halal Goods Market on Saturday, inshallah. We will be there bringing to you everything that is taking place over there. And don't forget to purchase your tickets on the Halal Goods Market site. Find them on social media, and you can take it from there. And yeah, send us your comments, questions, queries, or suggestions to our WhatsApp line on 061 766 And don't forget to follow us on Facebook, Twitter, and Instagram. I am going to nurse my flu right now, take my medication, and get some rest. And I'll see you on Saturday, inshallah. And the Salam Media team. Assalamu alaikum wa rahmatullahi